In a world where vaccine skepticism is on the rise, rebuilding trust in vaccines is paramount. Martin Kulldorff, the head of the CDC's Vaccine Advisory Panel, is determined to address these challenges. He believes that restoring public confidence requires scrutinizing government vaccine guidance with a critical eye. Health Secretary Robert Kennedy Jr. has encouraged questioning, stating he is not anti-vaccine, fostering open dialogue around vaccine safety. Kulldorff emphasizes the need for public health to regain trust. His committee has already recommended removing mercury from certain flu vaccines, aiming to prioritize safety while addressing concerns. However, these decisions have raised alarms among public health officials, who fear they may further increase skepticism. Amidst these changes, Kulldorff insists that scientists must embrace humility. Understanding potential rare side effects can enhance the integrity of the vaccination schedule and help rebuild trust. Trust is a two-way street. The CDC must earn public confidence while acknowledging the skepticism many have towards it. Kulldorff acknowledges the missteps made during the pandemic, emphasizing honesty as crucial for rebuilding that trust. He believes the responsibility for restoring trust falls on public health officials and scientists, rather than being a political issue. This is a societal concern, as loss of trust has real implications for funding and support for scientific research. When asked about public perceptions of political influence on the committee, Kulldorff asserts ACIP's independence. The committee focuses on evidence-based recommendations, despite some expressed concerns about fellow members' motivations. Current recommendations limit the options for children regarding certain vaccines, citing health risks. Kulldorff clarifies that while parent choices are still allowed, the committee prioritizes what they see as in children's best interest. ACIP's commitment extends to making evidence-based recommendations without overstepping into vaccine mandates. Kulldorff cites detrimental impacts from COVID vaccine mandates, arguing that high vaccination rates can be achieved without coercion. Reflecting on Sweden's success without mandates, he highlights that confidence in a clear vaccine schedule can lead to high participation rates. Moving forward, Kulldorff argues for rigorous trials to evaluate vaccine safety and timing in providing doses, ensuring ethical considerations guide these decisions. In conclusion, re-establishing trust and integrity is essential for public health. Kulldorff's commitment to transparency and evidence-based practices offers a pathway for rebuilding public confidence in vaccines. Engage with the conversation about vaccines, understand the recommendations, and contribute to a healthier society. Please share, like, comment, and subscribe to the channel so my mom could be proud of me.